we are going to be deciding who is going to be on your ballot box and who are you going to tick. That is in your hands. And of course, the roadmaps are still going on. People are still doing campaigns, and I hope you're following them. And please be very careful when you're going for these campaigns. Today, I'm honored and delighted once again to have Dr. Adrian. Last time we talked about the bones, the nerves, and the muscles. And you know, the concern of the people was they haven't seen these things. So today, this morning, we decided that Dr. Adrian can demonstrate for us what all this is called and what we need to know about this. I don't know if you do remember this. We started it in primary. Hafiz actually was telling me that because these things would, you know, take long to understand them. So we studied them. But this is a skeleton, if I'm not mistaken, right, Dr.
Yes.
Adrian? Anyway, before we go any further, to the people out there watching, to our dear viewers, please introduce your name and tell us what we're going to talk about this morning.
My name is Adrian Kakoza Mgenyi. I'm a physiotherapist, and today we're going to talk about back pain, and I'm going to talk about discs, where people say they have prolapsed disc, and one of the other common things is called sciatica, pain that goes down the legs, that comes from the back.
Is it the pain that you get and you feel some little things pricking you under your feet? Needles, yes, okay. So this handsome man this morning is very, very naked. And I can see we have a lot to learn about. Ouch. So where do we start from?
First of all, let me introduce you to the spine. As you can see, this is the spine, this is your vertebral body, backbone. And this backbone, in it you see those big bones, and in between the bones, you see those small things coming through. Why don't you bring the other bigger model?
Ah, okay.
That one will do as well. Yes. So in this spine.
So this is the spine. So basically this is my spine as I'm standing.
As you're standing.
Okay.
Standing from your head, we have
my head like this, and then it goes up to the.
You have 7 bones that are in the neck. Then we have 12 bones that are in the thoracic region. And then we have 5 bones that are in the lumbar region, the Chwatawata region. Then we come to the hip, and then this is the sacrum. Now, as you see, at each and every bone, in between them, we have a small disc in between.
Okay.
Every bone, you see that whitish, that see-through is a disc. And those discs help us to prevent the nerves you see here from compressing with each other. When those nerves are compressed, they will give you pain radiating to your hands or pain going down into your legs. We can see this here best on this other one.
For you?
Yes, on Mr. Jones here.
He has a name.
Yes.
Mr. Jones. Hi,
Jones.
Mr. Jones. We're glad to have you this morning.
So Mr. Jones here can show you better that in the neck, you have the nerves that come from the neck and come to your
So people would
hands.
want to know, these are the nerves?
Those are the nerves.
Please show them so that they can be able to, because last time they were asking us about the nerves, about the bones and the muscles.
Yes.
Yes.
So now these are the nerves, and they come through your neck this way into your hand. And then in the lower back, we still see nerves. They are coming from this side here and down into your legs. So we have the brachial plexus that comes into your hand. And when we get injured, or sometimes people are doing certain kinds of work, and the nerves in the neck compress, they'll start feeling pain in the shoulder areas. They'll feel pain in their hands, and sometimes needles and pains come into their hands.
Yeah, like you have thorns under your feet, under your hands.
And that could happen because the nerves have been compressed here. The same happens in the lower back. If in the lower back, your nerves in the lower back are compressed, they'll give you pain coming down into the legs.
Oh, wow.
And which is sometimes called sciatica. So there are different types.
So the pain is called sciatica pain?
Yes, radiculopathy pain that comes down. Now, most of the times when we get these pains, and you've not had an accident, you do not have fevers, you do not have history of cancers, physiotherapy would manage these conditions for you. But if you have these pains, and if you have needles and pins, but you've lost a lot of weight, or you're involved in an accident, or you have other diseases like TB of the TB
lung.
of the lungs, sometimes it also comes to the spine.
Wow.
So now those are pathological diseases. Now I'm going to talk about the physical things that happen in the spine that give us pains. For example,
Okay, wait, let me ask. And now, if I have pain on the side like this,
yes.
you know, on the side, I think
please.
it's also considered as the back, if I'm not mistaken, and then it comes down here. What does that mean?
Yes. Still in the back, after talking about the nerves, we have muscles. And those muscles would come and insert here and then go down, and they form your lower back muscles. And they have a form like that. But once in a while, we get these muscles injured, and then they'll give us pain in the back.
How would we get these muscles injured?
These muscles would get injured, one, or because of repetitive stress and tear. Some people would sit in office in very bad postures, and then you get that pain. Your spine, let me demonstrate.
So is the spine supposed to be very straight?
You need to protect our spine by, first of all, keeping it in proper postures. For example, the spine is intended to keep, it has curvatures. We have a curve in the neck here.
Comes like this.
Yes, and then you have a curve in the lower back. But sometimes, if I'm going to demonstrate now on you, we have this curve here,
All right.
and then we have the curve that comes in, and then we have the lower back. However, sometimes you're going to find some people who have stooping.
Who their backs are a little bit bent like
they're
this.
a little bit bent, and so their biomechanics is not well balanced, and this will give people back pain and to injure some of the muscles. Now, some people are sitting for so long and they do not have any physical activity done, and it is weakening their back muscles. The most cause of back pain is lack of physical activity.
Exercise, like skipping a rope once in a while.
Lack of physical activity. You can.
Okay, when you say lack of physical activities, which kind of physical activity do we include in something else that I wouldn't want to mention on air because we have young children that are watching? Yes.
That physical activity, yes, is also very important. It should not be missed. So people should have physical activities in their body beyond office and sitting all the time.
Okay.
So what happens when we have these pains? In physiotherapy, like we said, we have different modalities of treatment. In some of them, we have...
I was looking at this beautiful light. Immediately you put it on, it's literally burning.
Yes, and this lamp here is called an infrared lamp. It gives us heat. The heat, that heat helps, yes, in relieving the pains in the muscles. We can either use heat that is visible like this, or sometimes we use hot packs, hydrocollators to help with that kind of pain.
Is it the one that we were talking about last time, that you know, some use ice and then others use very hot, some of us, we call it hot stone massage, the stones that they use.
You can use heat in different varieties. So this is a demonstration of some of the heat that we can use in treatment. As therapists still, we have, as we are going to demonstrate, we have different kinds of treatment techniques. One of them is something called dry needling, which is like acupuncture. It's painless, but then it helps to target those particular muscles into, it helps to target those particular muscles in the back and relieving them.
Wait, I see people when they go for massage, they use needles. In physiotherapy, is it Chinese? Are they needles? What are they? Or some people, you get a cup and then I don't know whether it's hot and then they put it on your back.
Yes, and those needles is called dry needling, and those pins, we get them and they go into the muscle and they hope to get those trigger points. Is it painful? It's a bit uncomfortable, but it's not that, I wouldn't say it's painful. The needles are micro thin, and we are going to demonstrate it here, and we shall also show you a bit of cupping and what can be done with it.
Well,
yes. So,
okay.
I would, when we look at the back, when we talked of the muscles and bones, there's a time people get pain that when you stand up to walk, you have pain coming down into your legs. But after you've walked for some time,
then the pain disappears.
The pain increases But if you sit down and you stretch your back a little bit, the pain reduces. So when you have that kind of pain, we shall think of it as someone having pain which is common in something called stenosis. In the conditions like stenosis, we have inside the discs here, the space keeps reducing. It could be to old age, it could be to trauma and some other factors in life that
Can
we
I
may
get
not.
that at my age?
Yes, we've seen stenosis coming in at very early ages with some people, so they will have that discomforting pain. And
But this doesn't apply in children, in babies.
it may not really happen.
Okay.
So we're going to do particular kinds of exercises to help out in those patients. Now, there are ladies who have that particular kind of pain that is very common, that we've seen it with people we praise to have good nyash. In the back, we have something called a lordosis. If you can turn face the other side. This curve here in your back, as it turns, is what we call a lordosis.
Okay.
However, some ladies in our country have been endowed that that curve is so deep into them that even if they lay down, they are not able to be flat. So they have a
There's
very
a gap
big,
in between.
a very big gap. Now, in that gap, I've seen patients where in that gap, even the bones move in, and they cause something called lumbar spondylolisthesis. So the bones have moved, and because of that exaggerated lordosis, and then you find this lady with pain every time they get to sit down, they feel pain, or when they get to walk, they feel pain and a lot of back pain. So most of the times what we get to do is to
Someone
do
just said my Nash,
proper-
like really.
proper yes, before we get excited about nyash, you know, every gifting has
A problem.
a problem. So we get pain that comes in. However, when women give birth as well, these bones here we call the sacroiliac joint in between here, these bones here are fused, but during pregnancy they open up for the woman to be able to give birth. Now, some women will stay with some residual pain. They will feel pain in between these joints, or when they get to walk, the pain increases.
Oh, okay.
Or when they sit for some time, they feel pain. And this is coming in because what we call this is the place where they put most of the weight. It gives pain. However, we have other ladies during childbirth or they get trauma, this last bone or the tailbone gets to be injured. And when it gets to be injured, every time they sit, they will feel pain into their lower back. And in between their bumps, they feel a lot of pain. And this bone here is called a coccyx bone.
Okay, wait. Let me ask something now. If you said that when you sit in between the bum, you feel pain. If you haven't given birth via the other way around, and some people have given birth via the, you know, the C-section, and they still have that pain. What causes
Yes,
that pain?
because generally when you get pregnant as a woman, you're going to get a certain hormone called relaxin. And that hormone typically prepares your body to give birth. And in the process of it preparing your body to give birth, it relaxes all the muscles in your pelvic area. And then it will also break. So even if you did not give birth with naturally, some women could have this pain through pregnancy, and then it can continue even after pregnancy. But sometimes people get trauma and they get that coccygeal pain coming through their legs, coccygeal pain. But what do we do with most of these treatments? As physiotherapists, we come in, there are some techniques people do. Some of them is called manual orthopedic techniques, where we're going to mobilize these joints to create space in them. The other things we're going to do are going to be exercises to make sure that we strengthen the muscles that hold this spine together so the pain reduces. And I think we are going to get to demonstrate to someone to demonstrate for us, and we take it from there. We see how we do this.
All right, so we are going to, can we take a very short break as we have our patient come on this bed to just lay down, and we have something just to cover her up, just our dear viewers. Nothing is going to be seen. We do have a sheet right here where our patient is going to be covered. And yes, we're national broadcasters, so something. So we're going to go for a very short break, and then we come back. We're going to be looking more at how we can manage this kind of a pain.
Get your favorite health tips right here on U24. Maintain your kidney by drinking 8 to 10 glasses of water each day. This can be in form of soup, tea, water, cooked grains, and boiled vegetables.
Hello, my name is Erica Murunchi and welcome to Be Inspired by Erica. So today I want to talk about personal hygiene. Personal hygiene is not just a habit, it is a way of life. By maintaining personal hygiene, you will reduce stress, improve on your focus, show respect for yourself and others around you, to the people around you. Take care of your space and your life. Keep your room tidy, wash your hands, cut your fingernails, comb your hair, brush your teeth, and many others. Take care of your space and your life. Brush your teeth, make your bed, bathe, cut your fingernails, comb your hair, and make...
Shiba is a lady who still sits in office full-time most of the days without general muscle pains. So what I'm going to do today is to demonstrate. We're going to do some spinal mobilization. When you're done with spinal mobilization, my colleague Alsat is going to help us demonstrate dry needling on helping relieving most of her back, and then we'd see. Okay, Shiba, if you could help me, could you turn and lie facing upwards? Yes. Okay. Okay. These manipulations, I'm a certified orthopedic manual therapist. So please do not do this if someone is not trained to do this kind of thing. Okay, can you turn and lie on the sides facing me?
Which kind of a person is supposed to do that?
These kinds of procedures, lie on the sides facing me. These kinds of procedures are done by therapists who are fully certified and trained to do this. So I wouldn't encourage someone, can you hold your hands together like this? I wouldn't encourage you if someone is non-trained, or chiropractors.
Did you just hear that sound?
Okay. Can you lie on your tummy? Yes, help me that pillow. As such, you're going to demonstrate to us, you're going to show us a bit of dry needling and what we shall be doing. Let's put this below your tummy area.
So,
Alsat,
tell us what she's doing there. What exactly are you doing?
So dry needling is a clean procedure. So the patient, the therapist has to wear proper gloves, disinfect the place, and then we're going to use our small micro needles that we're going to just place into the muscles. So what is challenging?
Pulling out the gloves.
Yes.
So the needles that we're using are the ones that help.
The needles, they're very small, micro needles. They just go straight into those affected muscles, and when they reach, we just get into what's called trigger points and agitate the trigger points to give relief to the muscles that are affected. It's a clean procedure, and the therapist is going to wear the glove. The therapist has on her gloves, and we disinfect the place with alcohol so we are able to get into this. So when Shiba, if you're in discomfort, please you let her know. And so what are you doing now? Which muscles are you targeting?
So I'm going to target the muscles of the lower back, especially the erector spinae muscles.
Yes.
Those ones that... no, I'm targeting the muscles in the lower back.
Okay.
We have deep muscles, and then we have the superficial muscles.
All right.
So now I'm going to target the deep muscles, the erector spinae muscles in the lower back.
Okay.
Shiba, it's not painful. Just relax. It's so relaxing.
So in dry needling, there we have different sizes. So here around the lower back, we use specific sizes. This is size 40. We have size 50 and then a 75. But we try to use a smaller size so that because we have nerves around here, so we go to an area. We have landmarks. So the first landmark is finding the last rib so that we don't injure the lungs. So I'm finding your last rib.
So that we don't get any damage on.
Yes.
Oh, and Alisat is a certified trained therapist. She did a more certification in dry needling. These are accreditations therapists keep doing to upgrade themselves. I'll be the assistant here.
Then after we find the ilium, the iliac crest, and also the sacrum. Reason being, on that model, we have nerves just above here. So we're just going to target L5 and then L4. So when I touch and then the pain is when you feel the pain, you tell me. Is it painful around here? Then here?
Yes.
Yeah. Okay. So it's just a small needle.
Okay. So it is to help with the pain.
Yes, and in muscles sometimes they form what we call trigger points. So those trigger points, they become very sensitive, and then they cause tension onto the muscle and sometimes the nerves, and then you feel that pain. So I'm putting it in. 1, 2, 3. It's in.
Wow. Well, Shiba this morning is one of us, and we're demonstrating on her. Shiba, is there any pain did you feel anything over
How does it feel?
Tingling.
Okay.
So then I can also put it on this other side of the spine. So here mainly we target my fascial trigger points. 1, 2, 3.
So
How does that
we see
feel?
these things in movies, and we look at them and say these are the most, there's a lot of pain when we see them. But wow, this is quite interesting. So Shiba is not feeling any pain.
Yes.
Shiba, is there any
Shiba, are you feeling pain?
No, but some tingling.
Okay.
Something.
All right.
So this, whenever we insert a needle and we have those trigger points, these needles, they help us release that tension. So the muscle reacts by giving a muscle twitch. When that twitch comes, it's just an involuntary muscle contraction. That means that the muscle there is some relief. Yeah.
The pain that was there is no more a little bit.
Yes.
Okay.
So it helps the muscle stretch out fully and receive enough oxygen.
So, our dear viewers, what you're watching is a demonstration of what Dr.
Dry-
Adrian, what did you call it?
Dry needling.
Dry needling is called, and it is to help with the pain in the muscles. Okay.
Yes. And now we're going to show cupping for the upper back.
Is that the cupping that I was talking about earlier?
Yes.
Earlier?
Yes.
Okay.
We're going to do cupping for the upper back. And also I'll start to show, these are some of the techniques that are borrowed from different histories of science.
I actually see the Chinese use it the more.
Yeah, the Chinese have been using these treatments. Even cupping, we've been using it here in Africa to treat. So some of these techniques have been histories of science and people modifying them and using them. Like many Muslims will tell you the Quran says that we should take blood from them. Though conventional science says it's sham medicine. The people have been practicing, the Orientals who have been using this, and some of the patients who use with them say it's very good for them.
So other people prefer the
Cupping,
cup.
dry needling. So sometimes with dry needling, with something we do mainly for younger people, sportsmen who have those muscles that they use all the time, and they're getting a bit of muscle nodes.
So Tyson can be one of them that it can be used on you.
Yes. So because they have bigger muscles, and muscles have this kind of mechanism of formation. So sometimes when they get injured, they lock in and form what we call knots. So those knots become the painful part of the body. Most of the times, if someone touches and when they come in, you're able to feel they are very tense in patients. So what happens with that? It gives the pain. And besides these are what we call pain relieving modalities of therapy. But one of the things we'd recommend the patients to do is exercise.
So you would prefer me to do exercise than to do that. Is it addictive?
No, we're not saying it's addictive because there's a time you're going to come in and there's too much pain within your muscles. Yeah. That even if we start doing exercise at that time, you'll be causing more pain. So one, we need to prepare the muscles to be ready so that we are able to do exercises with less pain. So in the passive times of therapy, this is what we start with, but exercises should be started on. Please, we do the cupping.
So we're going to do the cupping?
Yes, we're going to show a bit of cupping, and then we shall demonstrate those exercises that are very essential on helping.
Now, in the cupping, Dr. Adrian, if I may ask, is the cupping that we see that we see in movies whereby sometimes they put there something that is hot and then they put it on your back and then
yes. But then for us we are not using that one now. We use suction cupping. Okay, use this. We use suction cupping. Okay. No.
It's not painful.
I said, what does cupping do?
Cupping, whenever you have pain, it helps improve blood flow in that localized area and also relieve the pain you have.
Is that wide?
Is it painful?
Use a small one.
I can hear my client is complaining that there is pain.
Because of the suction.
It's the suction.
Okay. Some of us would call it pulling of the mass of the meat. Probably.
No, we use the smaller one. Muscles on that side. Yes. So when people are doing cupping, we can do cupping either with where they use cupping to massage around or just that. So this will help us to bring the blood closer to the surface. And then when we are done with that, we're going to do all soft tissue manipulations, what people call the massage, which can be followed with, then we can choose either should I use light or not. So as we can use the infrared light or not, or, yes, we can use the infrared light, or I'm going to prepare to do a bit of exercises.
Okay. So what kind of exercises are those, or what kind of massages are that?
Okay, can you remove this? Let me remove this pillow. So, the kinds of massage, we typically, as therapists, we do not have what we call that this kind of massage or that, but we have particular kinds of manipulations. Can you take a deep breath in and out?
Is that the crackings that we hear?
Yes. Can you take a deep breath in, ma'am, and out? Okay. Now you're going to help me with your hands on the sides of the body. No, just like here. And push your chest up. And push to lift your chest up. More like that. Very good. And down. Push your chest up again. Push. All the way. All the way. Yes, I'm trying, these are mobilization of the lower spine, and these are called Mackenzie manipulations that we use most of the times when people have pains that are radiating down to their legs. But can you turn and you lie on your back? I said, can you help us do with her exercises to stretch the lower back?
So Dr. Adrian, okay.
So we are going to do a simple demonstration of how someone can stretch their lower back, and we take it from there.
So we can do that even when we're at home?
Yes, we can do this even when you're at home.
How is this painful?
So do I need help when I'm doing that?
This, because she's with a therapist, but these are activities you can do by yourself. We are trying to move the spine as much as possible. But if you're doing any of these activities and you feel pain in your back, please stop.
Why would I stop? Because I would feel if I do it and I feel pain, the more I keep on doing it, maybe that's when the pain can reduce.
Because that means if you're doing an activity and the pain increases, you're injuring, unless your therapist recommended you to do it. But if you're doing it by yourself, please, I would encourage you to stop doing that kind of activity. So there are also tests as she's moving. There are some tests that we can do to confirm which kind of the nerve was injured or where do you get the pain. For example, I said, can we do a nerve floss for a sciatic nerve?
Well, before we go further, well, I'm not there, but I would ask you, doctor. Some time ago, when we used to play basketball, and I, injured my ankle, but I keep on feeling this bone moving. Sometimes when I'm driving, I have to do like this to put the bone back in position. What is that called?
Yes, the ankle joint, like we see, it sometimes gets a lot of dislocations, but ankle joints take a bit of time to heal because
It's been like ages.
They have poor circulation
of
and
blood.
When the pain starts coming in with the ankle, when we tell people you need to exercise and strengthen the ankle joint more, we've seen ladies most of the times get something called plantar fasciitis. Elsa, tell us about plantar fasciitis.
Okay. Plantar fasciitis, down here, we have what we call the plantar fascia. It is the covering that covers the muscles in our foot. So sometimes you have the heel bone, so it starts from the heel bone, then it spreads all the way to your toes. So when there's inflammation, and sometimes when you're this kind of person who stands for long hours and works on hard surfaces, there's what we call inflammation. Inflammation is what the body, how our body reacts to an injury. So every time we have an inflammation, then we get that plantar fasciitis. It is that early morning pain when you get, it is always a sharp pain.
When you wake up from your bed and you put your feet down.
Yes, and even when you sit for long hours and then you try to stand up and take a step, there's that sharp pain you get.
Wow.
Yes.
So
Okay.
to heal that pain in the ankle, it would mean when you start feeling the pain in this fascia, that now we need to strengthen the whole mechanism of the ankle joint. So we would encourage you to do what called calf pumps to help you with that kind of pain.
All right.
However, you could have pain down here in your ankle, and you feel it coming all the way back into your lower back, into your hip. Then we need to differentiate that either that is not caused by a nerve or it is indeed a pain within your ankle joint. Sometimes when we have injuries in the lower back, in the sciatic and the lower back, we get pain coming down into the ankle joint. So how do we tell if pain is for the fascia, or how do we tell if pain is caused by the nerve? How do we tell, Alsat?
We do what we call the straight leg raise. So you take your leg up straight, and then we test it. We test the sciatic nerve. Is that painful? A stretch.
So this is called a straight leg test. In the straight leg test, we stretch and stress the sciatic nerve like we saw on the other bones.
Oh, yeah.
It comes all the way down. So when we do this, we're able to know if we get pain coming down into your legs and you have ankle pain, then we know that is not now just at the ankle, but it's pain coming from a nerve.
They say that some of us who put on high heels, like our patient there, it's also the cause of,
Oh.
Is it true? We're just assuming.
It's not assuming. The way Shiba is comfortable and at ease, if you look at her foot, you notice it's dropping forward and turning in. For people, when we start wearing very high heels, we have something called the Achilles tendon. It's this bone here, this tendon here. But because you wear heels all the time, you're going to push that tendon, and sometimes it gets to shorten because of high heels. Though it's a beautiful thing, because when we do this, it gives the ladies a very good, if I'm standing like this and I just pull my hips, I'm going to get a bam bam.
Yes.
And that also increases the lordosis. Remember the lower back we talked about?
Yes.
It increases because you've pumped yourself up. However, when we're still talking of, so high heels would give you that discomfort with some people. Now, there's a time people have pain coming down your leg, and it's not caused by the nerve compressed in the spine, but your nerve is compressed in. Take my gluteofibrosis.
The gluteofibrosis and the piriformis syndrome.
What happens in gluteofibrosis?
Gluteofibrosis, long time ago when those people used to take the quinine injections, it caused some effect whereby we have wasting of the gluteal muscles, and then it affects your sciatic nerve.
This one is talking of the gluteal muscles. It's a bit confusing. You've seen ladies, Sheila, who have a bum and those big depressions in the bum.
Yes.
Now, those were caused by a bad injection given to the muscle in the lower back, in the bum area. So that muscle is this muscle here. This muscle here, when you're being injected, Shiba, can you turn, face me this side? Thank you very much. When you're being injected, you notice your nurses tend to avoid or draw something like a cross on your bum, is to avoid the sciatic nerve. Unfortunately, some people are injected and they injure that muscle. When they injure that muscle, the nerve still passes through the same area and to be compressed. Now, gluteofibrosis, we see it in ladies when now the muscles become tough and the lower back also becomes, they're not able to move and they'll start getting back pain. Then what do we, which tests do we do to confirm that someone has pain caused by gluteofibrosis or sciatica or coming from nerve compression? Yes, please test for me.
So we do the piriformis test. So you bend your legs.
So Dr. Adrian, we basically see a lot of people, and it has been all over social media, where people go and they crack their bones. Then they... what does that help with?
Yes, as we're still showing you, this is the test for the piriformis. So sorry, when we do this and you feel pain coming to the gluteal area, then we shall know that the pain is typically coming from your bum muscles that are tight, and we also see it in people who sit for long hours. Now, you've talked of the cracking. What beneficial is it? Orthopedic manual techniques have been around for so long, but they are not typically the treatment that someone is going to give. We need to follow it up with exercises. However, there are so many people cracking, and everyone can crack their bones, but to make sure that your therapist who's doing that work for you is certified to do that kind of work. So, can you, Shiba? So these are some of the exercises. Anyone out there, if you're feeling pain in your back, please you can do this and to help you relieve your back pain. Can you lift your legs to your chest? And this is something anyone can do, and you bring your head in and take them out and then back, and we can do this 10 times. Very good. And again. This is the part of where our patients don't really enjoy the therapy bit. Can you lift your pelvis up? We can start by one. Keep the other one leg straight.
Is that one of the hardest exercises in physio?
There isn't any hardest exercise in physio, because most of our exercises shouldn't be hard. They should be easier for the patient to do. Can you bend both your knees? Very good. And lift your pelvis up. And this
helps with the back, lower back?
Helps with the back and also strengthening the cores. Okay, can you turn onto your tummy?
Well, doctor, as the patient is turning, a quick one. They normally tell us that with the ladies that give birth via the C-section, there's a way that injection that really affects our back. Is it true?
Oh, yes. Now, that injection you're talking about, like we saw on the spine, that injection will be, give me the smaller spine. For the anesthesiologist to get the effect.
Because basically you're bent.
Yes. The anesthesiologist to get the effect for you, one, why is this guy? Yes, like that. Your spine is turned in. They compress your spine and target somewhere around here and inject the medication. When the medication is injected in, it stops the pain going down in all your lower back. However, where that injection has passed, in some patients, they keep with residual pains that keep hurting even after they've given
I
birth.
for one, am a victim. It keeps on, the pain keeps on coming back. Like so, when you do heavy work, when you do a lot of stressing and a lot of physical exercises, you really feel that pain. Literally, you're feeling like one of the leg is numb.
So what happens with that is when you're given that injection, we start with pain and everyone tells you, oh, your back is hurting.
Yes.
You're not supposed to lift anything. Now, remember they've created a scar in that muscle and you are not moving whatsoever. And because you're not moving all the time, the scar keeps growing, the muscle is scarred, now it becomes weaker. And in so doing, it becomes harder for you to manage that pain, and the pain keeps increasing with over and over. So we'd highly encourage a patient who has had that injection done to seek therapy so that we help you with those muscles. So we're going to show you some very interesting exercise as we go on. Yes, can you kneel on falls? Kneel on with your hands like that. Fantastic. And even come up more. Yes, like that.
Kneel.
Legs, bring your legs forward a bit. Yes, and then can you try to backs, neck, hands, bring your hands in a bit. Can you hatch in your back? Very good. And lift your back up, your pelvis back up. Higher, then down.
So what kind of exercise is that
Now,
that we're
this
doing?
exercise, we are trying to create more flexibility within the lower back. We are trying to give our flexibility into those joints. And this is called, what's it called?
This is called the cat cow.
The cat cow movement. Then if someone that doesn't hurt you, we can try to move more to the front and neck up. If you feel no pain with that, we can go on, but if it hurts, then we get to stop.
So that one helps with the...
We are trying to stretch all the core muscles, the back muscles, so to relieve the pain they have. Ultimately, in the treatment of back pain, exercise is the proven modality of managing back pain.
So basically, exercise in back pain is the most important one.
The rest of the other things we do to relax the muscles, to relieve pain, but the ultimate treatment for the back is exercises.
Wow.
Okay. All right, can you lie flat?
So all that we're doing is to help with the back pain.
Yes, we are stretching the back as much as possible.
So doctor, why is it that in most cases, most of the patients that come to do physiotherapy have issues with the back, be it at the young age and be it with our parents? Why?
Back pain is the most common condition amongst adults. 80% of adults will complain of the back. And because we've had a lot of change in our lifestyles, before we used to stand to relax, before we used to sit to relax, now we stand to relax. You get the challenge.
Yes,
Our walks
yes.
have changed. I would ask a person like Sheila, when was the last time you even moved more than 2-3 kilometers?
Well, I do take a walk around Chisasi Chanja, of course, with my better half, but of course he moves faster than I can.
There's a better half.
And I'm dragged behind. Dr. Adrian, come on, please.
So the other thing we've
but of
talked...
course, when I walk, actually, doctor, I feel like my knee is swelling and my leg, I can't move anymore.
Then you come in, so we prescribe for you the proper exercises for your knee and the ankle. So sometimes other people have pains in the neck, yeah? And someone will have pain coming through this neck here, radiating down into their hand.
Some of them, we see them putting on something like,
And
what is it called?
A cervical collar.
Yes.
So sometimes when people have been sitting for long, and we even notice it in ladies in the village who have been weaving most of the times, where they get this hatchback up here. And when they get that hatchback, they start stooping in and they have pain radiating down into the hands with needles and pins. That could be caused by what we call steel discs being compressed in the neck here. And they will give you pain coming down into the hands and needles and pins as well. So this pain, sometimes it would even give you shoulder pains. So what do we do with this kind of pain? And we saw the orthopedic manual techniques we did to mobilize the neck. But the next thing we are going to do is encourage someone to do a lot of exercises for the neck to help them.
Okay.
Yes.
So we're now trying to help the back.
We've seen the back. We've done exercises in the neck. However, there are different forms of pain people have.
Yes, true.
For example, there are people who have back pain. I'm going to move this. Someone will tell you, I have back pain, but when the pain increases, I have pain that just comes just at the back of the thigh and then to the front or to the toes. Then we can know that your discs have been compressed. Which places are those?
That is L5 and S1.
L5 and S1. So with the kind of pain patterns you have, we are able to determine which part of the joint or which part of the spine has been injured. For example, when people have, Alsad could tell us one of those pains, costochondritis.
Costochondritis. Okay, in costochondritis, we have what we call the breastbone, that bone that separates your left half and then the right.
Bring the model. That separates the right?
We have the breastbone.
Yes, that separates, yes,
yeah,
there's a bone here in the middle.
And then from this. So sometimes when we don't have, when you're lacking enough vitamin D3, vitamin D3, it has that anti-inflammatory property. So when we have low levels of vitamin D3, we have what we call inflammation takes place at a very high rate, and then you start getting pains around these joints which join to your sternum. And then you start getting that sharp pain in your chest, and sometimes it radiates or moves to your shoulder, and sometimes to your hand, or even your upper back here, just behind your shoulder scapula here. Okay,
Dr. Adrian, as we do wind up, she's still explaining to us about what happens when, just in case I have that, sharp pain in the chest, what do I do?
There are two kinds of sharp pains. If you're sharp pain, you don't have a heart problem.
Yes.
You do not have cough.
Yes.
You do not have fevers, and it's mechanical. Please, you come in and we'll show you exercises to do. However, we have another headache called cervicogenic headache. I'll start with cervicogenic headache people get.
Cervicogenic headaches, that pain usually get from your lower neck here, and then it radiates to your eye, and even sometimes to one eye, and also this other side of the head, at the front of the head. So it really comes when your muscles of the neck are very stiff or very tight, and then they start giving you those headaches.
Yes, and when some neck muscles are also, some bones, discs in the neck are compressed, they'll give us that pain that comes into a tension headache, cervicogenic headache. So those are some of the common conditions that are related to the spine. Physiotherapists manage, and we showed you some of the things we use to manage.
Okay.
The most common
the
thing...
light, we haven't seen the light.
Hey,
yes.
You see the light here.
I'm very interested in that light because I have, they have ever put it on my ankle, and my friend.
The infrared light is the signature treatment from Mulago. That's not a joke, but that's what everyone knows about physiotherapy in Uganda.
Yes, even me, I know about the light.
The lamp, this lamp gives us some warm heat. It's very good for the muscles. It also has a psychological effect. Someone really sees something very hot on them, and
they will know that they're getting better.
And they're getting better. So it helps us relax the muscles, and when the muscles are relaxed, you're able to do exercises more and easier with the patient. This infrared lamp, or sometimes people could use a hot compression. Other people have hydrocollator packs, which they just put onto the back to heal the pain.
Are those the ones that they keep in the fridge?
Yes, they know the other ones will boil, but then some others we can use heat or ice on the back.
Because I don't know, my head is so much into the ice. Why? Because I saw my mom, they would get something very cold and put it on her, then she shivers. And you're like, oh my goodness, this woman is about to, to shiver out.
Yes. So, and when we put this machine on, like for example, the infrared, get me the TENS unit, the infrared machine and all this, we ensure that the person is conscious enough, they're able to tell you that I'm feeling hot or not. If they're not able to, we'd encourage people not to do that, because the patient has to be conscious. And once in a while, the last thing we use for treatment is something called TENS. And this is trans-electrical stimulation that we use, we use to help us in managing these pains. We pass through some currencies through your muscles.
It's not painful?
It's not painful. We're not physical terrorists. We are physical
therapists. Physio and therapy.
So we're not terrorists.
Okay.
So the infrared, the TENS, helps us in our body generates currents. And since our body generates currents, what we do, we also give it currents to help it relieve the pain. And then we also use it when the muscles, for example, if you had a spinal injury and your nerves are non-functional, we have different ways we can turn it on to give us better. You can stimulate the nerves with the electricity. We can also stimulate muscles. And the patient has to be conscious and able to communicate with you. Now we are going to start.
So I'm turning it on.
Shiba, you're going to feel some electricity. One more.
Shiba, is it?
So it helps us contract the muscles, and we can do it for 10-15 minutes. And this is also good, is one of the physical therapy modalities. We have other things like ultrasound therapy, but this is what we could demonstrate to you, how a typical physiotherapy session would look like.
All right, I guess that today we have seen what the doctor has been doing to our, could we call her our patient or our client, Shiba? And Shiba, did you feel any pain? Do you feel any change?
I feel better.
You feel better? Well, she kept on saying that she wasn't feeling pain, but by the end of the day, by the time we finished, she's actually feeling better. So Dr. Adrian, just in case someone wants to come for help, where do they find you?
They can find me at the rehab clinic in Alia, in Spine Drive, or at MFK, Orthopedics and Pediatrics in Muyenga.
Okay, your phone number so that the people can, actually, I know you're going to get lots of calls after this demonstration. So just in case someone would love to, reach out to you, your telephone number.
Our phone number is 0752-045-865. Yes, and you can get us on TikTok. We have lots of demonstration for exercises. The Rehab Clinic on TikTok.
All right, thank you so much, Dr. Adrian, and thank you so much, Hajat, for coming and showing us.
Dr. Hajat.
Dr. Hajat. Yes, Dr. Hajat, thank you so much, Msawa, for coming in, to demonstrate. Sometimes we see these things in movies, like the drainage, like the needles, like the,
the cupping.
The cupping.
The technologies.
But the technologies, now I have now seen it with my eyes. And I am overwhelmed and I'm like, I think I can give it a try and come and maybe do one or two. But after, we're going to work on one of the patients called Tyson, the one who decided to fly or to, get through the window as the bus was moving. But thank you so much, Dr. Adrian, for coming in today. We have learnt a lot, and some of the things that we didn't expect, basically about the nerves and the muscles, which was very important about the back. So we appreciate you. Thank you so much. We'll have you more, teach us more about, these things. Perhaps we'll have something new that we'll learn about that next time that we invite you for the show right here. Thank you so much for being part of this beautiful show, all the way from the hour of 9 up to this hour. One-on-one, we always do this every single Saturday. We bring you different people so that you can learn. And of course, through learning, it can help you. So some of you were at home and you really were, feeling you have a lot of pain. But I guess today the doctor has showed you different things that can heal pain and different things that they can use in physiotherapy. But his main concern was, do not just walk to anyone. Walk to a profession and make sure as you're walking in there, should they do anything and you feel like the pain is becoming more and more, kindly stop it, and either you can look for him and he will tell you what to do. But thank you so much for being part. But also remember, 2025, 2026, the ballot paper is going to be just right in front of you. So the future is in your hands, who to decide who you will vote. So the campaigns are going on. One thing that we'll urge for the young people, please take time as you're doing this. Do not overdo it, because you might lose your life. So learn how to ride your bikes as you're doing the campaigns, and also do it in the right way. Thank you so much. We'll do this again next week, same time.